More than 1 billion people under orders to stay home as India looks set to extend its lockdown. We ask if the country's poorest have been left to starve to death. I'm Imran Garta, and today on the Newsmakers we go to South Asia to look at the impact of COVID-19 in India. India is home to some of the most densely populated cities on earth, making it the ideal place for a virus to spread. So, when COVID-19 arrived, the government took drastic action and imposed a lockdown. It brought the nation's almost $3 trillion economy to a standstill. With all non-essential businesses closed, those bearing the biggest brunt are the nation's poorest. Millions who rely on daily wages have been left without work and without money to feed their families. But a lockdown of this magnitude was a gamble Prime Minister Narendra Modi was willing to take. If the coronavirus isn't contained, India's hospitals could buckle under the load of sick patients. Even with the current rate of infection, medical teams are working with limited personal protective equipment, making them more vulnerable. So, slowing down the spread is crucial. But how long can one of the world's largest populations remain under lockdown and survive? Adam Pletz reports.
घर में रहे और एक ही काम करे कि अपने घर में ही रहे.
That was the start of the largest restriction of movement in human history. To combat the coronavirus, India's 1.3 billion citizens were ordered only to leave their homes for essential purposes, or else face a year in jail. The initial lockdown was announced on the 24th of March for 21 days, but is likely to be extended until at least the end of April. And it came into force with less than 4 hours' notice, throwing India into chaos. As businesses closed, millions of migrant workers who survive on daily wages were left with no means to earn a living. Fearing hunger, hundreds of thousands set off walking, with little money or food, on days-long journeys to their rural villages.
हाँ तो घर पे सभी को जो है राशन दिया है, गेहूँ दिया, घर है, वहाँ तो सभी चीज़ है, वहाँ कोई दिक्कत नहीं।
और कमरा मालिक मेरे को वहाँ पे मना कर रहा, आप लोग घर जाइए, खाने के लिए दे नहीं रहे, क्या करूँ मैं यहाँ पे? छोटा बच्चा है, उसके दूध के लिए परेशानी हो रही है। प्रॉब्लम ये है बस, अब तो चलो अपने जैसे कुछ अपना कंट्रोल कर लेंगे दिल को, मगर बच्चा वो रो रहा है, मेरा बस यही प्रॉब्लम है। बस हम कैसे भी अपने, अब यहाँ पैसा नहीं खाने के लिए, अब उसको मैं दूध कहाँ से लाऊँ सर?
At least 20 people have died on these journeys, some from starvation. Security forces have humiliated others, spraying them with disinfectant. The lockdown had sparked the largest migration in India since the bloody partition of the British Raj in 1947. And as the scale of the exodus became clear, state governments scrambled to provide transport. According to the Delhi Times, 90,000 people crowded onto congested buses from a single location on one day alone. Partly in an attempt to dissuade travel, the government has announced direct cash transfers and food subsidies to help 800 million of India's poorest citizens.
We have come with a package which will immediately take care of the concerns, the welfare concerns of the poor and suffering workers and those who need immediate help.
But few have bank accounts to transfer the funds to, and many say they have not yet received any money. The International Labour Organization says 400 million Indians working in the informal economy risk falling deeper into poverty. It's too soon to tell if India's lockdown is really working, or whether the exodus it caused could actually accelerate the spread of the virus to rural communities. But in its haste to act, did the government fail to anticipate the lockdown's effect on many of the country's most vulnerable citizens? Adam Pletz, The Newsmakers.
Well, let's put those questions to the government and speak to the national spokesman for India's ruling BJP, Syed Zafar. Also on the panel, Hartosh Singh Bal, who's the political editor of the Caravan, a long-form journalism magazine, and Hartosh Singh Bal is a medical doctor and national president of the Progressive Medicos and Scientists Forum. Hartosh Singh Bal, let me start with you. Is the lockdown working?
It depends what aspect of the lockdown you're looking at. Are people staying at home? They largely are. Has it managed to mitigate the problems of the growth of the coronavirus? To a certain degree, yes, the growth rate is lower than in most countries, but what it has not taken into account, one is what was going to happen to a huge number of people who are suddenly without jobs, without money. They depend on their daily wages or monthly wages. They've been forced to leave home, no provisions were made. 22 people have already died trying to get home. So a large part of the deaths that have taken place have come from the badly implemented decision. And the second problem, which is that we should have been preparing, stockpiling PPE, ventilators. Right. We have not made headway because we have acted very late on these matters.
Okay, so I'm going to pause the issue of PPEs for the moment, if you'd allow me. We'll talk about that in a few minutes' time. I want to talk more generally about the lockdown with Syed, Zafar, Islam. The fact that people like Hartosh are saying this hasn't been managed well, and people are going to starve to death because hundreds of millions of people work in the informal economy, and the lockdown doesn't have clear guidelines for them, and there's no way for them to absorb the blow of the lockdown. That's fair, isn't it?
Not at all. Let me give you the correct perspective and the correct picture. Of course, the lockdown was announced, and the clear guideline was that nobody should move from their home and stay. You just showed that what the Prime Minister was appealing to the nation, every citizen of this country, that you stay home, do not venture out, do not go anywhere, because everything, all your needs will be taken care of by the authorities. Something which people, they wanted, because these are the people who had come from different cities and come to the bigger cities from the smaller cities and they work in this bigger cities. So obviously they wanted to go back home because lockdown for 21 days, something very big for them, and they wanted to be with their family. That's why suddenly they came out, despite the appeal made by the Honorable Prime Minister to every citizen in their address to the people of this great nation. It happened only for a day, and of course everything was addressed, those concerns were addressed, the transportation was arranged, and people went back to their home cities. But away from that, every single day, you just see that it is being managed very efficiently. The announcement which has come from the government in terms of the welfare scheme and the relief package which has come from the government was to the extent of 1,70,000 crore, which is massive.
And to that point, yeah, sorry to interrupt you. I don't like interrupting, but I've got to come in here. That economic package, the relief package, as we heard in Adam's report, hundreds of millions of people don't have bank accounts. How are they going to get access to those funds?
Allow me to complete. So there are people who have the bank accounts are being provided the direct benefit transfer. People who needs ration, those who are having the ration card, they are being given through the distribution network of the Government of India and the state government. They are being provided free ration from these outlets. Then away from that, the food packets are being provided by the various agencies, the government. The numbers are there. WhatsApp number is there. The various other numbers have been advertised.
Okay, so let me take what you said. Okay, so let me take what you said and pose it back to Hartosh. And Harjit, I'm going to come to you in a couple of minutes, so don't feel left out here. But Hartosh, are you satisfied with what you're hearing from the government representative here? That there are multiple packages available, and maybe you need to give them a little bit of time in order to do this properly?
Well, I think this has been part of the Modi administration, grand gestures without follow-up, and a lot of statistics that are touted. But the migration problem did not last for a day. People are still reaching home. It took weeks. The deaths have taken place with people walking back thousands of kilometers. Food is not getting to people. Adequate arrangements have not been made. These announcements, and our reporters are reporting back time and again from places, all that the government is claiming is really not reaching people. And there is a strict attempt to control the media narrative itself that reports on what the government is failing to do. We are facing a crisis of immense magnitude in terms of feeding people, making sure some livelihood is ensured, and ensuring that they manage to come out alive at the other end, not because of the coronavirus, but because of other hardships.
Okay, and I'm glad we have the ability to have this conversation here. so that everybody gets a fair opportunity to have their say. Let's go to Hartosh Singh Bal now. Harjit, to the issue of PPEs, or personal protective equipment. First of all, how short is India when it comes to this basic protective equipment for the doctors and for everybody else involved in trying to tackle this virus?
If we talk about the healthcare workers, like in India, the hospitals were divided into basically three portions, like the high risk areas where directly the healthcare workers are involved with the COVID positive patients, and then the moderate risk and the low risk areas. Like now what we are seeing, that many of the healthcare workers who are working in the low risk areas, or even who are looking after the non-COVID patients, even they are getting infected because of this coronavirus. They are coming positive, and many of the hospitals, big hospitals, and many of the healthcare workers were put into quarantine, and they were now they are now in isolations. So this increases a doubt that whether a proper management of PPEs, like there is definitely a shortage, and shortage is worldwide, means not only in India, even the world is seeing the shortage of PPE. So shortage is there, but whether it is appropriately provided or not is again a major question which is coming forward, like because India don't have a very good strength of healthcare workers. Means
Right.
if we talk about the public health.
Harjit, if you can address Syed Zafar Islam directly, he's a member of the government, he's from the BJP. How do you feel they can more appropriately direct those PPEs to the people who need it? Tell him directly.
Means I will suggest that first of all, like because we have a shortage of PPEs, all of the infrastructure which we have now, like even the corporate or the public, they all should be made to make more and more personal protective equipments. Because even in the largest of the largest hospitals, we are using like a one N95 mask is used for 4 times or 5 times, which may doubt its effectiveness also. And the second thing is the chances of infection will raise. But we are forced to use it repeatedly. So if whole of the system can be used to make more PPEs, that will be more a better thing. Because the administration is not providing because we have shortage, though ministry and the government is not accepting this fact, and I suppose Zafar sir will also not accept this fact. But the issue is that we are facing a shortage of PPEs, and like now railways have started making PPEs, and many of the PPE manufacturers were making, but even they are not able to meet the demand of the people. So more industry and more corporate and even the more PSUs, like public service units, they must be involved to make more PPEs.
Zafar Islam, you accept that criticism? Will you do better?
It's a constructive criticism, and I don't deny that initially, yes, we were, all of us globally, everyone was struggling with all the PPEs demand and the supply what was available. But today's situation has changed. Of course, the first few days maybe the bottlenecks were there, the people were struggling with that. But today, I think we have sufficient number of PPEs being supplied to hospitals, being supplied to health workers. And of course, if you see the overall demand, India hosts 20% of the world's population. So you can understand in terms of the demand suddenly, which is coming up because of this pandemic. Even if the world's demand, if you just bring it to India, it will not suffice the total demand which we had. But of course, it is being addressed, and it has been addressed successfully. And whatever the shortfall was there, a lot of industrial houses and the companies and the railways are being engaged to manufacture PPEs. So the initial few days, of course, there were some shortages, but things are getting streamlined, and we will not have any issues. What Mr. Bhatti said, that, and I take this this criticism constructively, because we are all in the war mode. Everyone is fighting to somehow ensuring that everyone who is engaged in providing these services, especially the healthcare worker, they need to be sanitized. They need their interest needs to be safeguarded. They need to have PPEs available at their disposal all the time. That is being addressed.
Okay,
and
so,
it has been addressed.
Right.
But course,
okay, so let's take that to the man. Let's take that to the man who initially brought up the issue of PPEs, Hartosh Singh Bal. So the government's narrative is that, yes, we had stumbling blocks and we had some problems at the beginning, but now we're more in control of the situation. Do you buy that?
Not at all. Let me just put down some simple facts. The government was exporting raw materials for PPEs till 19th of March. Ventilators were being exported till 24th of March after the lockdown. This was the time India should have prepared its stockpile, be ready for what is coming their way. We are now in the process of gearing up the productions of PPE and ventilators, which we were sending abroad. There's an acute shortage with 10,000 cases. We still do not have enough PPEs or ventilators to deal with the cases we have on hand already. This doubling rate at the moment is 5 to 6 days. We are, over the next 6, 10, 15 days, going to see cases go up to 20, 30, 40,000. If we are facing a problem right now, what awaits us a week or 10 days down the line is something that none of us want to see. And it is the government's responsibility directly for getting us into the situation.
Zafar?
Actually, I must give you the correct statistics. I think Mr. Hartosh Singh Bal, Hartosh is maybe he doesn't have a statistics, or he have not heard the daily briefing of the health ministry. In terms of the arrangement and pandemic, just see do a back testing and see number of people who require hospitalization, number of people who require a ventilator. If you just do a back testing and require how many patients need to go to ICU, then you will understand that in terms of preparedness, government initially specified a hospital, the railways coaches have been converted to hospital, and in terms of bed, we have total number of patients today which has been hospitalized is 1671, and total number of beds is 1,20,000 beds, which is available with the government, only dedicated for the COVID-19 patients. So the preparedness is there for the government, and every day it is getting increased because we are converting hotels to hospital. We are converting smaller places, smaller hotels to hospitals. Then we are converting coaches. Every day new coaches are being converted to hospitals. And then in rural area, we are preparing tent, which can host 2 patients. And even if there is a rainy season, it can still survive comfortably.
Okay,
all these
Okay, so I mean, you have a lot of confidence in the capacity of the state to be able to cope. I want to ask Harjit, the medical expert on the panel here. We've seen with countries with, and I mean this is no disrespect to India, with better infrastructure than India, Italy, Spain. We've seen cities with world-class infrastructure, medically and otherwise, like New York City, suffer under a deluge of new infections and really struggle and with tremendous strain to their system. Help me understand, if the rate of infection increases in India, in the big cities, in New Delhi, in Calcutta and elsewhere, over the coming weeks and months, does the country have the capacity to be able to cope and give these people adequate treatment, those who become infected?
See, first of all, we have to understand the India's healthcare system. It's very much, because of the federal structure of our country, it is very much dependent on the states of particular states. Like if you see the states in the southern India, like Kerala, Tamil Nadu, they are better equipped even prior to COVID also. And if you see other states which have a large population, like a dense population, they were not well prepared or well doing even now. And if we talk about the preparedness, like now we have to see that which type of patients. If we are only talking about the COVID, like the COVID patients, then okay, the government is trying to make preparations for to tackle this situation in an emergency. But if we see even the non-COVID serious patients are getting neglected, and this also coming as a major challenge to our healthcare system. Like if a patient who needs a dialysis, who needs a chemotherapy, or other patients who are serious patients, but they were denied admission because now whole of the system is tackling only COVID patients. And when it comes to a COVID patient, then also our testing is have a very limited criteria, and mostly we are testing only those who are admitted or who have a history of travel. So we know that the spectrum of this disease shows that only 20% of the people need admission and only 5% were critical. So even while testing them also, we are only searching for severity of infection rather than the whole spectrum of infection.
Right. And there's a big fear in a lot of places that it's the knock-on effect, right? Those people who don't even have COVID will struggle to get the adequate treatment. Yeah, finish your point. Sorry for interrupting you, sir.
Yeah. So this way, the first thing is that because of the large population of India, so 80% of the people who don't have a severe infection to get hospitalized, they were getting away with they are not getting admitted or getting tested, but they have a tendency to infect other people. So in this way, we may see this disease in a longer period of time. Means more and more patients will come. And the second thing is that our healthcare system is already exhausting because there are very limited beds in public healthcare system. Like whatever facilities we are talking in, that we are making railway coaches into isolation or quarantines and other things, that is a different thing. But hospital bed itself is a different thing, which have a full equipped structure to save lives. So this structure, we have a very limited structure in public healthcare system, though our corporate or private healthcare have some structure available in it.
Okay,
so till now, because we are using only public healthcare and it has limited capacity. So I am very doubtful that with this, if influx of patients will increase, how much we can tackle this disease is difficult. Yes.
Yeah, and my apologies. We have limited capacity in terms of time on this program. That's why I've interrupted you, and I'm so sorry for that, Harjit. Syed Zafar Islam, it would be remiss of me not to bring up a political / cultural / religious issue that's connected to this. Everything is political in India. Why are BJP officials blaming Muslims for coronavirus? Easy scapegoats?
Not at all. I am an official spokesperson of BJP, and I will tell you candidly, and I come from the Muslim community, and I'm one of those a spokesperson who believe in my religion, and I'm practicing Muslim.
Certainly, but there are BJP officials who spoke of human bombs and corona jihad, because Tablighis, who are a subset of Muslims, a section of Muslims, yes, they had a gathering in early March, but why are all Muslims being blamed for corona?
Allow me to complete. All I'm saying that Tablighi Jamaat congregation had happened. They failed to inform the authorities. I mean, they have been found positive, corona positive. Large number of people who had gathered.
Certainly.
So it is a section of the Muslim community, society, but nobody is blaming the Muslim community. Nobody is
okay, but this is from the New York Times. Rajiv Bindal said human bombs, right? Listen, so Rajiv Bindal from your party called them human bombs. In the village of Harawali near Delhi, a mob beat Mahbub Ali, a young Muslim man, for attending Tablighi Jamaat events and filmed the beating. Tell us your plan, someone shouts in the video. Was your plan to spread corona? Mr. Ali, bloodied and crouching in a field, shakes his head. That's from the New York Times. Again, you have mobs. This is already politically fiery, and this is politically a big problem in the country. Why are officials from your party stoking these tensions in a time when everybody has to band together in order to stop the virus?
No, I think the whole country is fighting this virus. We are in a situation we have to fight and prioritize to fight pandemic rather than politicize issues.
Right.
There are people in every political party who unnecessarily speak, and I think those people should understand that somebody from my party also, because the party leaders, party leadership, party official spokesperson, and party party has authorized to speak have never spoken, never dragged the religion, never dragged the Muslim community, and those who have, even from the party who have spoken, they have not been supported by the party at all. There are people who unnecessarily try to sensationalize it, issues like this, and only for their personal benefits. But those people are far and few. There are 99% of the people do not bring religion in situation like this, and they should not.
Hartosh,
and I totally condemn those.
Hartosh, there's a minute left on the program, and we're going to drop off air when this minute ends. Wrap us up in 30 seconds, please, sir.
Sure. I will just wrap up with this last thing you said. Islamophobia has driven the BJP from non-existence to power. It is continuing with that in the middle of one of India's biggest health crises. the BJP is looking to make political windfall and shift attention from its own failings on infrastructure, on migration, and its leaders are very much party to the Islamophobia that is trying to keep attention away from the government's own failures.
Gentlemen, we wish India all the very best in flattening the curve and fighting corona well, as we hope the world will do over the coming weeks and months. Syed, Zafar, Islam, Hartosh Singh Bal, and Harjit Singh Bhatti, I thank you all very much for joining us here on The Newsmakers. And thank you for watching. We will see you next time. Bye-bye.